what a great day. I'm not going to sum it up because we do have experts in that vein. I'm going to ask Dr. Bianchi and Dr. Lazar to take the final words before they hand us off to Dr. Liberatore to close out so that we can go on to the rest of our days.
Thank you, Dr. Jacobson-Dickman. I would say that probably the students were the best final words. So I honestly will, I will start by thanking them because this last part was absolutely, I would say even eye-opening, and but it's really energizing because it shows us how much again, the principle of partnership and all working towards the same goals is the most important one that is emerging, I think, from this symposium. I really want to extend my gratitude to my colleagues, the organizers, the presenters, all the participants of this third annual Learning Environment Symposium. When we started planning this symposium, I remember that was a few months back. I think we didn't know where we would ended up in details in terms of the specific content of the symposium, but we clearly from the very beginning knew that we had to address the issue of conflict. It was important if we wanted to effectively improve the learning environment. So I want to thank you all for this event that has provided a forum for a rich discussion on conflict resolution in the context of medical education and the healthcare practice. Interpersonal conflict, in fact, we know is a core issue of professionalism because it impacts directly in a negative way learning, teamwork and dynamics, and patient care ultimately. So developing a strong conflict resolution skills is crucial for producing competent and professional physicians and healthcare providers who can actually navigate these agreements in both an ethical and effective way. So as we conclude this symposium, I think we are reminded that the practice of medicine extends far beyond the diagnosis and treatment of disease. The presentations that we've heard today, I think really challenge us to consider how compassion can coexist with efficiency, how empathy can inform ethical reasoning, and how conflict, when approached with an understanding of complex, all the complex issues in the context, and with honesty, can become actually a catalyst for growth rather than division. So professionalism in this sense is not a static construct defined by the checklists of appropriate behaviors or by rules of institutional policies, but it's rather a living practice that gets nourished by reflection, dialogue, and shared accountability. Professionalism flourishes in environments where individuals feel psychologically safe, and we heard this emphasis put by essentially all the contributors, including the students in this last panel on this aspect. Everyone has to feel safe to express vulnerability, curiosity, and moral concern. So I hope really that this symposium serves as an inspiration to foster a culture of kindness, I would say, that does not compromise rigor, integrates compassion as a core professional skill, and seeing ethical tensions as opportunities again from revitalization of interpersonal relations. And I think that this clearly would be my take-home message of all these wonderful presentations and contributions this morning. Thank you.
Dr. Lazar, did you have any words you would like to share?
Oh boy. Dean Jacobson-Dickman asked me to summarize today's session. So in summarizing today's session, I hope to maximize gratitude and minimize my shame for not doing this summary probably the justice that I should. First off, thanks to Dr. Carla Liberatore, Assistant Dean of Wellness, for beginning the symposium with a brief meditation fostering gratitude and readiness. I suspect that her calendar just filled up for various one-on-one sessions. I thank President Riley for introducing Dr. Kathleen Reeves, President and CEO of the Arnold P. Gold Foundation. It's interesting that since Gold Humanism sponsors various white coat ceremonies at medical schools throughout the country, she opened by stating that the white coat represents the oath to prioritize the human connection. She went on to expand upon the fact that humanism is not an art, but is actually a science, the science of how people behave when they trust and when they sense that people care. She provided 3 cases that highlighted our lived experiences, shape patients' behaviors, and that healthcare providers need to give patients the benefit of the doubt because they may simply be doing the best that they can. She went on to elaborate that patients trust when they are understood and that lived experiences and context matter. She showed a brief video highlighting Toyota-inspired management changes at the Virginia Mason Medical Center. It's remarkable how she used the thread of blue yarn not only to help to see how far cancer patients have to travel in their medical journey, but also how it became a symbol of the need for a shift to a more patient-centered design. She offered the following actionable suggestions. 1, lead off a patient encounter by trying to understand the patient rather than diving right into the chief complaint. 2, learning about ourselves by reflecting upon our own stories and take care of ourselves. When the physician is not well, it becomes evident in their care. 3, focus on human connection. I love the expression that connection is a vaccine to conflict. And 4, recognizing that the most dangerous culture is one that pretends to be perfect. The second lecture, Dr. Ashraf Rushdie, in a true humanities teaching style, presented the stage set for conflict, the theater, the space of work and teaching of work, individuals, and the various opportunities for different types of conflict. I don't think I've ever heard a single lecture that quoted Socrates, Achilles, John Wayne, George Bush, Mitt Romney, and Taylor Swift, all in the same presentation. He stressed the balance of gratitude, outward emotion, and shame, inward emotion and conflict, and expanded profoundly that conflict falls within conflict because of social pressures. He differentiated between the feeling of and the practice of gratitude and compassion, and differentiated between sympathy and empathy. He offered the following pragmatic suggestions. 1, emotions that are expressed are sometimes even more important than those that are felt. Compassion is a requisite for conflict, but that conflict and rigor can coexist. And as Dean Bianchi reflected, compassion that someone can offer on behalf of someone else is important and matters. There was a lot of discussion about the power of the preemptive apology, and that an apology can still resolve conflict, even if it is less than 100% genuine. And I love the expression, life becomes easier when you accept the apology that you never got. In the third session, my dear colleagues and friends, Dean Jacobson Dickman and Boonton Foster, presented 3 cases which underscored the points that words matter and the importance of the chief complaint, because the chief complaint anchors the medical interview, balances the humanistic and scientific aspects of care while identifying the primary reason for the visit, and guides the rest of the evaluation, diagnosis, and treatment process. Simply put, the chief complaint drives focus and direction. They went on to illustrate that stigmatizing language and demographic labels presented without context perpetuate deleterious narratives, reinforce discrimination, and perpetuate health inequities. The words we choose in clinical documentation and in various communications shape learners' perceptions, as well as their prescribing patterns, but also influence the electronic medical record and embed bias and inaccuracies into AI algorithms. Lastly, Diane Booten Foster's REACT framework provides a structured method to reflect and revise clinical documentation, various communications, while fostering empathy and diagnostic equity in clinical practice and teaching. We should once again congratulate all of our kudos recipients. And I agree with Dr. Bianchi. You simply saved the best for last. Student panelists reflect on their various lived experiences prior to and during medical school. They highlighted various aspects of their professional identity formation, including a growth and respect for people's time, energy, and demands, caring less about image and more about intention, raising value for small gestures and moments of recognition, which was cited by multiple students, the importance of centering professionalism on creating safe space, whereas compassion is a major component of competence, and the importance of having a name and a voice. Dr. Myers cogently commented that individuals with lived experiences are moving the needle, but that allyship may be quite synergistic. In final statement, I actually viewed taking most of the day off to attend this was going to be a luxury, but I actually feel some shame. It's no longer a luxury. This was an absolute necessity. Thank you, everyone.
Now let's refocus for the rest of our day with the help of Dr. Liberatore.
Thank you. I just want to say one comment. It was such a powerful, I had to be a little in and out, but just powerful, inspirational, full of love, just amazing symposium. It made me just feel like I'm part of a big family. I'm so proud to be part of it. So now I'd like for you to please close your eyes once again, close your mouths, and begin to find your breath. Breathing deeply in, feel your chest rise, breathe deeply out, feel your chest fall, and begin to imagine a gentle waterfall flowing over you. Breathe deeply in and breathe deeply out. The water of this waterfall is filled with great compassion, empathy, and unconditional love. Breathe deeply in and breathe deeply out. Feel the flow of the water from the top of your head, softly over your shoulders, across your chest, and into your lap. Continue to breathe deeply in and breathe deeply out as you feel this loving water flow down your thighs and over your knees and to your feet, your glorious feet. Feel your feet as you breathe deeply in and you breathe deeply out. Feel your heart. Now your heart is full of all the compassion, empathy, and love we've shared today for yourself and for all beings. Breathe deeply in and breathe deeply out. May you walk lightly in your day-to-day journey with your beautiful heart as your guide. Breathe deeply in and breathe deeply out. If you lose your way in medicine or in life, find your breath. Feel your feet and open your heart. Thank you.
Thank you. Have a wonderful afternoon, everybody, and thank you for attending.